I've explained to people that without Tucker Carlson, I do not watch Fox News. And some people have given me blank stares. Why? What's the big deal? What's the big deal about Tucker Carlson? Well, I'm creating this video to explain what the big deal is about Tucker Carlson, and I'm going to do it regarding the greatest story in our lifetime, the story of coronavirus. Early in 2020, the mainstream media and politicians were downplaying the seriousness of coronavirus. In fact, they were saying if you talk about coronavirus and how it came from China, well, you're being racist against the Chinese. Here's some of what Nancy Pelosi said at the time, going to Chinatown to counter this so-called racism.
You should come to Chinatown. Precautions have been taken by our city. We know that there is a concern about tourism traveling all throughout the world, but we think it's very safe to be in Chinatown and hope that others will come. I have confidence in Dr. Fauci at the National Institutes of Health, who has some further confidence in what we're doing. Prevention, prevention, prevention. We want people to be concerned and vigilant. However, we don't want them to be afraid.
So be concerned, but don't be afraid. Now here's Tucker Carlson saying, hey, you know what? There's some serious stuff going on. Now at this time, once again, the media was saying don't worry about it. There's not that many reported cases. And Tucker's going to address that. He says that means nothing because we're not testing. We're hardly testing anybody. So them saying, oh, there's only a few reported cases so far means absolutely nothing. He's the one that said this. I never heard it from anybody else. And he's also going to talk about masks, where initially they were saying, hey, don't wear a mask because that could be dangerous. And then later on, they admit that they lied to us to stop us from buying masks because there was a mask shortage. So they intentionally lied to us. But hey, here's Tucker, and you see for yourself. And for the people that see this and still don't get it, still don't see what the difference is between government, politicians, mainstream media, and Tucker, still don't get it that he has an independent voice, then I just can't help you at this point.
Good evening and welcome to Tucker Carlson Tonight. For weeks, the media told you it was wrong to worry about the coronavirus, a mysterious, highly communicable, lethal disease spreading rapidly around the world. If that concerns you in any way, if you think maybe we ought to take some steps to protect ourselves from it, then you're a bigot. Coronavirus panic is racist profiling against Asians, lectured some arrogant moron at Slate.com. A writer for the Seattle Times warned that, quote, yellow peril racism was the real epidemic fear, and so on. Countless publications wagged their fingers in the face of readers and told them it was irrational, probably immoral, in fact, to worry more about the coronavirus than the annual flu. So fast forward to today. What began as a regional outbreak in the city of Wuhan, China, is now spreading across Europe. Parts of Italy are shut down tonight. Catholic services and, in some places, funerals have been suspended indefinitely. The shelves are bare. Panic shoppers buying in bulk as in a natural disaster, which this is, and it's moving fast. On Friday, the Centers for Disease Control warned that it is, quote, possible, even likely, that America will have a general coronavirus outbreak as well. That shouldn't surprise you. China is the world's most sophisticated authoritarian government. Its leaders have shut down entire cities, dragged people from their homes in an effort to curb coronavirus. But it hasn't worked. Officials in our country have reported about 36 cases of the virus in the U.S. so far. But that's a misleading number. The truth is we have no real idea how many Americans are infected. Why? Here's why. As of yesterday, only 3 public health labs in the entire country were properly equipped to detect the virus. Fewer than 500 people in America have even been tested for coronavirus.
Fewer than 500 people at that time had been tested. Fewer than 500. Now, without that context, you might be thinking, oh, not that many people in a country have it. It's just a tiny amount. But with that context, it tells you everything. And the reason why Tucker Carlson is trusted is because he provides that context. He tells you the rest of the story. Because once again, oh, only a few dozen have been reported to have coronavirus. Oh, in a country of 330 million? Oh, that's hardly anybody. But that's only because they tested less than 500. And the truth is, thousands, tens of thousands, hundreds of thousands of people already had this. It was already pretty much everywhere.
Out of a population of 327 million. For real. Keep in mind that 5.5 million people ride the New York City subway every day. Worried yet? This could be serious. How likely is an epidemic in the United States? Are we ready for it if it comes? How many could die? So in any crisis, trust is critical, and not just for moral reasons, for practical reasons. The government can't coordinate a national response if the public doesn't believe what it says and doesn't believe the government's looking out for its best interests. That's why honesty is essential at times like this. When the government lies, people know, they can tell, and then they stop listening. From the beginning of the Chinese coronavirus epidemic, mask shortages have been a major problem. Some people hoarded hundreds or thousands of them. Manufacturers couldn't keep up. In some cases, apparently, they were sent overseas. The foreign countries we outsourced our factories to prudently decided to keep the masks for themselves. Nationalism is real in a crisis. And of course, here in the United States, our own government didn't have nearly enough masks stockpiled to cope with what has happened. Now, from the start, honesty would have been the right policy in the face of this. We could have just said to the public, we messed up, but healthcare professionals, the sick and the elderly need the masks most, so they get priority. And people would have understood that because it makes sense. But the government didn't do that. Instead, they told us lies, dumb lies, that anyone who thought about it for a second could see right through. They told the public, you shouldn't buy masks because masks don't work. On February 29th, the Surgeon General tweeted this, quote, seriously, people, stop buying masks. They are not effective in preventing the general public from catching coronavirus, but if healthcare providers can't get them to care for sick patients, it puts them and our communities at risk. The CDC amplified this untruth. Even now, the CDC's official coronavirus guidelines only recommend wearing masks for those who are sick or their caregivers. The press joined in, too. A CNN piece from March 2nd says this, quote, Americans don't need masks. The CDC says that healthy people in the U.S. should not wear them because they won't protect them from the novel coronavirus. In fact, face masks might actually increase your risk for infection if they aren't worn properly, but medical workers who treat patients with novel coronavirus do need them, unquote. Time magazine joined in to whine, quote, health experts are telling healthy people not to wear face masks for coronavirus, so why are so many doing it? What do you think, Time magazine, you moron? The article suggests that believing in masks is some kind of superstition, like not walking under ladders or being afraid of black cats. It's insulting. It's ridiculous. They're telling you masks don't work unless you work in a hospital? How does that work? Does mask effectiveness change based on what job you do? They're only useful if you're already sick? What? Coronavirus can spread from asymptomatic carriers. That doesn't make any sense whatsoever.
Now think about it, what he said. If you think about it. Now, how many people actually were thinking about it? But when he explains, they're saying masks are bad for you, but they do work for people in healthcare. They do work for people treating patients. How does that make any sense? And obviously, if you do think about it, it doesn't make any sense. But how many commentators challenge you to think? How many of them? They don't. They just want you to swallow what you're selling. They don't ask you to think. Tucker challenges you and says, hey, wait a minute. Think about this.
Oh, wait, you're just too dumb to wear the mask. Okay, because they're really hard to put on. Of course masks work. Everyone knows that. Dozens of research papers have proved it. In South Korea, Japan, Hong Kong, the rest of Asia, where coronavirus has been kept under control, masks were key. So look, we understand there's a shortage of masks. We understand only certain people should get them because it's a triage moment. We get it. But stop lying to us because it makes us cynical. It divides the country. Tell the truth. We can handle it.
This is a key, what he just said, that the philosophy, the government should never be lying to us. The government should be telling us the truth because we are adults. We can handle it. The government should never be lying to us. And that's what they did. And here's the Attorney General pathetically explaining why at first they said masks don't do anything, masks are bad, masks can be dangerous because you'll put it on wrong. And like Tucker said, how hard is it to put on a freaking mask? And then change his view? Here's his ridiculous explanation.
Well, that's a great question, and it's important for the American people to know that the task force always makes recommendations based on the science. And the science originally told us that people who wear masks are not protecting themselves from the virus. We actually recommend that people who have symptoms or people who think they may have a disease to wear a mask so they don't spread it to others. And the WHO, the CDC, and my office all initially stated that. What's changed? Well, what's changed is we found that there are a significant number of people who have asymptomatic spread of the virus. And so the CDC changed its recommendations today, and they now suggest that the general public consider wearing masks when they're going out in public so as not to spread disease to other people, particularly in situations where they may be closer than 6 feet from each other. A couple of really important points that I want you to know. Number one, this does not replace social distancing. The most important thing to do is still to stay home. If you're going
So once again, when it comes to the greatest story of our lifetime, Tucker got it right. Government intentionally lied to us. Politicians got it wrong. The CDC, these so-called trusted sources, lied to us. So if you're one of the sheep, don't watch Tucker Carlson. Whatever you do, do not watch Tucker Carlson. You like being a sheep, stay away from him as much as you possibly can. But if you want an independent voice, even if you sometimes disagree, if you want that independent voice, if you want something separate from the Operation Mockingbird going on, then this is a guy you should listen to, at least for his opening monologue. This is a guy you should check out, and hopefully this video has explained what the big deal is with Tucker Carlson. Anyway, thanks for watching. Until next time.
Cisco, do we have to leave all our good friends now?
Only until next time, Pancho. Adios, amigos.